Welcome to the Learning Center. This video reviews the CMS standards for physician documentation of admission criteria, the so-called 2 midnight rule. We'll look briefly at the key points of this regulation and demonstrate how the new admit order helps guide the provider through this decision and document challenge. The rule actually has two elements. 1, the admit order itself, and 2, the justification for the order. First, the order. You must choose between admit to inpatient services, or place for observation status, or place in extended recovery. The order can be submitted by ED physicians, nurses, allied health professionals, and residents. However, a physician who has admitting privileges must sign the order prior to discharge. Admit to inpatient services is chosen because either you anticipate your patient will require hospital services for a time greater than 2 midnights, or because the patient requires a surgical procedure that CMS dictates must be done as an inpatient. In this latter scenario, the patient may actually stay less than 2 midnights. The second element of the 2 midnight rule calls for justification of your decision. Your documentation should include the following. 1, an admitting diagnosis, and not simply a symptom. 2, attestation of necessity, that is an aspect of diagnosis, testing, and/or treatment that is consistent with hospital care. 3, your attestation should mention high medical needs such as severity of illness, intensity of services, or risk for adverse outcome. And finally, 4, you should include a tentative assignment for the post-discharge disposition, such as home or skilled nursing facility. For both observation and extended recovery placement, you should document the diagnosis and your rationale for a limited stay. 2 last pearls. 1, consider all time spent in the hospital, including the ED and observation hours, when calculating the 2 midnight minimum. And 2, skilled nursing facilities require inpatient midnights for placement. Observation midnights do not count towards the 3 midnights needed for a SNF placement. Now let's look at the function of the new admit to inpatient order. We're here in PALM. The new admit order is contained within all order sets that have admission orders. For this demonstration, I'm going to choose the order directly from the a la carte menu. The overall architecture of this order remains the same. You'll notice the 2 required fields that were present before, admission diagnosis and register patient to service. There are 2 new required fields, anticipated length of stay and justification for inpatient admission. I'll first fill in the 2 required fields that we already know about. Now that I've filled in these 2 fields, I'll move on to the new fields. The first is anticipated length of stay. The drop-down menu has 3 choices: at least 2 midnights, surgical procedure inpatient only, and OB Peds Rehab Hospice. The third choice is for those patients who are an exception to the 2 midnight rule. The window defaults to at least 2 midnights, and simply hitting enter will fill this field. The other new field is justification for inpatient admission. You'll notice above it helper text. This has 8 choices, and it's simply longer verbiage of what you'll find here in the drop-down menu. You see the list of 8 justifications. The first 7 are those that you would use for those stays that are going to last more than 2 midnights. The 8th again is for those patients who are exempt from the rule. For this example, I'll use number 1, risk of adverse event impacting life. I simply hit enter, and then I hit OK to save my order. One other element to demonstrate is what happens for nurses, allied health professionals, and physicians who do not have admitting privileges. Remember, if these caretakers complete the admission order, the attending physician must co-sign the order prior to discharge. I've re-entered as a mid-level. I've filled out the other required fields, But you'll notice that there's one extra field, admission order cosigner. The mid-level provider, or the physician who does not have admitting privileges, or the nurse, must choose a provider from this drop-down menu in order to complete this order. Once this is done, the admit order will appear in the sign queue for that physician. Ideally, this order should be cosigned before the patient is discharged from the hospital. To help remind the clinician of the necessity, you see here on the discharge desktop in red, patient has unsigned admission orders. All users of the desktop will see this in red until which time the admission order is cosigned by the admitting physician. I've entered PDOC on the same patient. I'll choose the adult H&P form. I go to the Assessment and Plan section. You see here that we've added elements that complement the admit to inpatient order. None of these fields are required. We have the anticipate greater or equal to 2 midnight stay, and this is a yes or no element. We have justification for inpatient status with the 7 choices that we see in the order. Finally, we have a reason for greater or equal to 2 midnight stay, and this is a free text box. Note that the justification field is auto-populated with the reason that I chose in the order, risk for adverse event impacting life. This particular field is bidirectional. That is, if I chose the PDOC template before I did the order and chose a justification, this would auto-populate in the order, and vice versa. Again, these are not required fields and are added here to assist you completing the documentation for the 2 midnight rule. This completes the video tutorial on the 2 midnight rule admit to inpatient order. Thank you for visiting the Learning Center.